This is Dr. Brett Talley Daniel, MD, neurologist and headache doctor. And today I'm making a blog post on does migraine with aura have an increased incidence of stroke? Well, migraine is a genetic inherited condition involving the brain, the trigeminal nerve, and cranial blood vessels, which consists of symptoms of episodic headache with intervening periods of normal health. 25% of women have migraine at age 42 and 6% of men at age 37. The three most painful human medical conditions are childbirth, kidney stones, and a migraine headache. Migraine is the fifth most common disabling medical condition and the 10th most common cause for a visit to the emergency room. For women, migraine is their most common chronic medical problem, more prevalent than heart disease, hypertension, diabetes, or arthritis. Migraine is a painful, disabling condition that strikes more than 1 billion people worldwide and between 38 and 47 million people in the United States. The question for today is, does migraine with aura, which is common, relate to stroke, and how does migraine do this? Well, there's an increased risk of stroke for migraine with aura. That's true. The risk is highest in women less than 45 years old who smoke cigarettes and are on estrogen-based birth control pills. Since World War II, there have been two large data centers studying stroke and heart disease. One of them is at the Mayo Clinic in Rochester, Minnesota, and the other one is in Framingham, Massachusetts, where those studies are performed at Harvard Medical School. Every doctor has learned to respect Framingham data, and Framingham data reveals a 6% risk of stroke in migraine with aura patients. Migraine with aura occurs in 30% of the population with migraine. The transitory symptoms of migraine turn into long-lasting neurologic symptoms of a stroke. Related questions. What are the features of migraine with and without aura? Migraine without aura, previously known as common migraine, has attacks that are usually severe, one-sided throbbing, and associated with nausea, vomiting, or sensitivity to light, sound, or movement. The pain of migraine is above 5 on a 5 to 10 scale. Many patients jokingly say to me in my office that the headaches are at 20 when I ask about a 1 to 10 scale. When untreated, these attacks typically last 4 to 72 hours, and a combination of features is required for the diagnosis, but not all features are present in every attack or in every patient. Migraine with aura occurs in 30% of migraine patients, and migraine with aura attacks are usually preceded or accompanied by transient focal neurologic symptoms, which are usually visual. Migraine with aura was previously known as classic migraine. Transient migraine aura visual symptoms may be positive images, such as seeing black and white or colored zigzag-shaped images that flash and move, or negative images, such as seeing a blank spot like a scotoma or only half of things. Non-visual aura symptoms may be numbness spreading from fingers to hand to cheek to tongue. Sensory symptoms occur in 32% of patients with migraine aura. An International Classification for Headache version 3 allows migraine with aura symptoms to only last 60 minutes. And when stroke occurs with this condition, the symptoms continue with the patient long term. The difficulty talking is called aphasia and maybe blocked speech or trouble naming things. The aura symptoms characteristically come on 30 minutes before the headache starts, although some persons have the aura in the middle or the end of the headache. At least one aura symptom develops gradually over 5 minutes, and/or different aura symptoms occur in succession over 5 minutes, and each symptom lasts 5 to 60 minutes. In a recent population-based study, 64% of patients with migraine had only migraine without aura, 18% had only migraine with aura, and 13% had both types of migraine, and the remaining 5% had aura without headache. Tension-type headache is usually bilateral, described as tighter pressure, and may be only mild or moderate in severity. It should be less than 5 on a 1 to 10 pain scale. Any severe or recurrent headache is most likely to be a form of migraine and to be responsive, hopefully, to anti-migraine therapy. These symptoms distinguish migraine from tension headache, the most common type of headache. Tension headache, however, is very frequent and is 70% of headache and relates to anxiety disorders, while migraine is 30% of headache. What is membranous infarction? Well, infarction is a medical term, indicates dead tissue, like the stroke that occurs in the brain from lack of blood, which is ischemia, or bleeding into the brain, which is hemorrhage. In lay terms, a heart attack is called MI, which means myocardial infarction, dead heart tissue. Migraine with aura and stroke is the production of membranous infarction. How does a stroke occur in migraine with aura patients? Migraine affects blood clotting and platelet aggregation, which relates to stroke mechanism. Migraine also accelerates hardening of the arteries, which means it advances atherosclerosis. People who have migraine with aura are more likely to have strokes caused by either a blood clot in the heart, which is called a cardioembolic stroke, or a clot within the brain's blood vessels, a thrombotic stroke, compared to those that don't have migraines with aura, according to research presented at the American Stroke Association's International Stroke Conference in 2016. Some people with migraines experience neurologic symptoms with the aura, such as flashes of light, blind spots, or tingling in the hand or face. In adult, symptoms usually happen before the headache itself. Migraine with aura accounts for less than 20% of all migraines, researchers said. In a 25-year-old ongoing study of 12,844 adults aged 45 to 64 in 4 United States communities, 817 participants were identified as having an ischemic stroke, a clot or a mass clogs at a blood vessel, cutting off blood flow to the brain. When they compared migraine with aura patients to those with migraine without aura, researchers found overall migraine with aura patients were 2.4 times more likely to have an ischemic stroke. Migraine with aura patients were 3 times more likely to have an ischemic stroke caused by a mass or clot that forms in the heart, dislodges and travels to the brain, this so-called cardioembolic stroke. Migraine with aura patients were twice as likely to have an ischemic stroke caused by a clot that develops in a clogged part of the blood vessel supplying blood to the brain. That's called a thrombotic stroke. There's no significant association between migraine with aura and ischemic stroke caused by blockage of small arteries that supply blood to deep brain structures. Those are called lacunar strokes. Since migraines alter the blood vessels in the brain, the greater incidence of strokes caused by blood clots in the heart or the brain's blood vessels suggests that migraine also affects blood vessels in the heart and the neck. That's what possibly leads to these specific subtypes of stroke. Well, what kind of strokes occur with migraine with aura? The usual type of strokes with migraine without aura, with aura, is a ischemic stroke as opposed to hemorrhagic stroke. Ischemic means lack of blood either from a closed artery or a thrombus from a clot. Thrombosis. An example of thrombosed artery would be blockage of the left carotid artery of the neck, which leads from the heart to the brain. Then with closure of the left carotid artery, part of the brain on the left side will be deprived of blood and will be so-called ischemic and could cause an infarct, which is dead brain tissue. This would be called a cerebral infarct. Emboli. Emboli usually formed in the heart in patients who have atrial fibrillation, which is an irregular heartbeat where the top part of the heart, the atrium, doesn't contract. This allowed blood to sludge and form a clot, which then drops down into the lower part of the heart, the ventricle. Then the ventricle contracts and shoots the clot into the brain, and severe large strokes can occur from atrial fibrillation. Hemorrhage. Hemorrhagic strokes are rarer with migraine and usually more severe and deadly than ischemic strokes. Hemorrhage comes from the arterial blood pressure at high pressure being pumped by the heart is released in the brain through a defect in the arterial wall. Why does cigarette smoking have an increased risk of stroke for migraine with our persons? Cigarette smoking is a terrible health risk habit. Nicotine is very addictive and almost as addictive as cocaine. Also, the cigarette smoke and burned ash byproducts produce cancer and lead to an increase in the risk of the development of atherosclerosis, which means hardening of the artery. The American Heart Association has strongly declared that cigarette smoking worsens atherosclerosis and increases the risk of stroke and heart attack. Cigarette smoking is listed as a risk factor for stroke. Why do estrogen-based birth control pills increase the stroke rate for women with migraine with aura? The worst combination of stroke risk factors are a woman with migraine with aura who's aged less than 45 years old and who takes an estrogen-based birth control pill, and she also smokes. Estrogen-based birth control pills aggravate stroke in migraine aura patients by increasing blood pressure and making blood hypercoagulable, which means it's more likely to clot. Estrogen-based birth control pills also aggravate or drive migraine attacks. They can cause abortion of a baby in the womb and increase the risk of breast cancer. Are there other reasons for stroke with migraine with aura? Yes, migraine with aura has a list of other things. I'll read a list here now. Patent foraminovaly, arterial dissection or cervical arteries, migrainous infarction, genetic predisposition, reports of polymorphism, endothelial dysfunction, coagulation abnormalities, decreased resistance to activated protein C, protein S deficiency, antiphospholipid antibody syndromes. And this is a large group of rare conditions which migraine with aura and stroke share. Migraine infarction is the occurrence of a CAT scan or MRI scan proven acute stroke that occurs during a migraine with aura attack. Patent foraminovaly is a controversial relationship between migraine with aura and a small hole in the heart left over in some persons from the circulation their heart had with their mother in her womb. It's been studied extensively to whether surgical closure will be helpful, and the result of that is not to do surgery at this time. Rarely, migraine with and without aura are associated with a tear in the inside of the carotid artery, a condition called arterial dissection. Dissection can result from unusual neck positions, such as turning the head too far to one side, and it can also occur with chiropractic neck manipulation. Well, what can be done to prevent stroke in persons with migraine with aura? All patients are called to follow the American Heart Association's recommended lifestyle, and that is, number one, the genetic link to atherosclerosis. All that can be done here is to be aware of familial risk factors for atherosclerosis and work on treating or avoiding them. These are stories where a dad has a heart attack at 40 and his son has a risk factor from that. Number two, exercise aerobically 3 or 4 days a week for 20, 30 minutes. Aerobic exercise increases the heart rate. Good examples of aerobic exercise are jogging, swimming, a stationary bicycle, rowing, Jane Fonda type group exercise, aerobics, and an elliptical machine. Treat hypertension, treat diabetes, lower cholesterol and lipids, avoid smoking, maintain a reasonable weight, and for migraine patients with aura patients, don't take estrogen-based birth control pills. So it's the end of the talk. Dr. Daniel on does migraine with aura have an increased risk of stroke? Please click subscribe there to follow so we can stay in touch with each other. God bless all you patients who've had stroke or have had migraine with aura, plain old migraine. And I will see you again on the next talk.